Hi, my name is Vanessa Frias, and today I will be doing my presentation on cocaine and the brain, the science behind the stimulant. What is cocaine? Cocaine is a powerful central nervous system stimulant made from the leaves of the coca plant. It is considered a Schedule II drug, which is legal for limited medical use but highly addictive. Different forms include powder cocaine, which is usually snorted, dissolved, or injected, and also crack cocaine, which is typically a solid, smokable form that produces a faster slash more intense high. This drug works by interfering how the brain processes dopamine, which is a neurotransmitter that promotes pleasure and reward. The history of cocaine. The discovery and traditional use of the coca leaf started in South America before the 1950s. This was considered the first cocaine era, in which South American Indians discovered the erythroxylon cocoa shrub, in which they would chew the leaf in order to gain more energy and also decrease their appetite. Cocaine's early medical use in the 19th century role in historical products as well. This is the second cocaine era, and this is when they actually used cocaine inside of Coca-Cola. This is also around the time where Sigmund Freud promoted as a treatment for depression and morphine addiction. And also Dr. Carl Kohler introduced it as the first effective local anesthetic for eye surgery. From 1978 to 1987, the United States experienced the largest cocaine epidemic in history. This would be considered the third cocaine era in which it became really popular and celebrities were using it as well. Also, around this time, the price decreased significantly, which made it more accessible. Psychological versus physical effects. When users are using the drug, they experience the psychological effects such as euphoria and intense happiness, increased energy, decreased appetite, high alertness, irritability or anxiety, insomnia, and hallucinations. Versus their physical effects, which could be increased heart rate, dilated pupils, tremors, muscle twitches, nosebleeds, which may lead to nasal damage, chest pains, and elevated body temperature. Some of the potentials and risks and dangers include for the physical health could be heart problems, irregular heartbeat, heart attack, and stroke. Respiratory issues, especially from smoking crack cocaine. Nasal damage from snorting, again with the nosebleeds, and they can also experience loss of smell. And some users experience seizures and high body temperature. As for the mental and emotional risk, these include addiction and dependence, which leads to strong craving and loss of control, anxiety, paranoia, and hallucination, depression and mood swings after the high wears off, and cognitive impairment, which can affect trouble focusing and memory loss. Here's the mechanism of cocaine. I would consider it like a cycle, starting with the first cycle or the first stage, which blocks reuptake of neurotransmitter. Normally, after these transmitters are released into the synapse, they they're reabsorbed by the neuron that released them, and this leads to stage two, which increases neurotransmitter levels in the synapse. Because the reuptake is blocked, dopamine, norepinephrine, serotonin is built up in the synaptic cleft, leading to number three, which is the overstimulation of receptors. So the excess dopamine overstimulates postsynaptic receptors, producing intense euphoria, alertness, and pleasure, which leads to number four, the sympathetic nervous system activation. Cocaine increases the norepinephrine activity, which triggers the fight or flight response, which is causing the increased heart rate, blood pressure, and body temperature. And then lastly is the after effects. When the drug wears off, dopamine levels drop sharply, leading to fatigue, depression, and strong cravings, and again leading to relapse. And it's just pretty much a cycle. Addiction and dependence. So how addiction and dependence develops. So repeated users also alters brain chemistry in which causes the brain to rely on cocaine to feel pleasure or energy. Over time, tolerance builds up, so users need more to achieve the same high. And then when cocaine use stops, withdrawals symptoms occur. Speaking of the withdrawals, these are the stages of crash. So we start with our crash, which is the initial abstinence phase consisting of depression, agitation, suicidal thoughts, and fatigue, which leads to withdrawal, including mood swings, craving, and hedonium, and obsession with drug seeking. And then extinction, normal pleasure returns, mood swings, cues, trigger craving. So typically in phase one, that's within the first 24 hours. Then we have phase two, the post-acute, which is typically 1 to 10 days. And then the protracted withdrawal is about 2 to 3 weeks. Prevention and treatment. So prevention strategies may include education and awareness, so teaching risk early in schools and communities, healthy coping mechanisms, encouraging sports, hobbies, stress management instead of drug use. And also, strong social support is really important as family and peer support reduce risk of experimentation. And then also, we look at treatment approaches. So, principal treatment strategies include inpatient and outpatient program. Also, drug therapy is often used to relieve cocaine craving and mood problems. And then we also consider psychological and behavioral counseling and support, as this will only be beneficial to patients that are highly motivated to getting clean. These are my references, and thank you guys so much for listening.